Uganda's challenge is with new infections. In 2023, 15,000 new infections were among young people. 4 of every 5 of them were adolescent girls. This majorly is attributed to increased cases of defilement and domestic violence. In 2023, there were 12,771 cases of defilement, up from 12,580 in 2022. The Ministry of Health has since put efforts towards prevention of HIV to control and perhaps break transmission by introducing pre-exposure prophylaxis drugs in 2017.
As I said, we started with 800 people on the tablets, but as I talk now, the people we have ever put on the tablets are over 700,000. Yes, it is taken orally, once daily, for the women and men who are taking it for a long time.
However, the uptake has since suffered some challenges, including transport to designated health facilities for refills and stigma. 6 of every 10 people who were taking the pills had abandoned the refills.
That's why we started doing outreaches into the community to take these drugs. We started going into drop-in centers. These are safe spaces for key populations and vulnerable populations. We started going into the hotspots, the hotspots, where mainly our KPs, sex workers hang.
In a recent move, the Ministry of Health and partners are now working with different public and private health facilities and pharmacies to have these drugs closer to those who need them.
It is a facility which will be referring people to those private pharmacies. And we tell them from the word go that these drugs are not for what? For sale. You just go and pick your medicines. There is no added cost to the person. It is the government which pays the 2,000 to 3,000 that the pharmacy, the private pharmacy, will ask for from a person. We have a memorandum of understanding so that every person who is served is given you pay around 2,000 to 3,000 shillings.
Dr. Kadama says the introduction of the vaginal ring has showed positive results, save for some known side effects.
The ring is inserted in the vagina and it takes 1 day before you are protected. So before that, you have to use a protective method. And 2, the ring stays for 28 days. After the 28 days, you remove because the medicine is over. I've been having some cases of urinary tract infections as a result of the ring and some few cases of STI. Most women have been reporting increased vaginal secretions, but that is expected. And when you put anything foreign into the body, there is increased secretion.
Now, the Ministry of Health will start using the injectable pre-exposure prophylaxis for men, with the first 10,000 doses expected in September, donated by USAID.
To begin with, we're expecting around 3,500 doses into the country. That is in February. But this will be continuous. That is the first batch which is coming in February, yes.
The fight against HIV and AIDS in Uganda, just like elsewhere in the world, requires prioritized funding for more desired outcomes.
We put a HIV fund in that, but it has not been operational. Even when we put the regulations to functionalize the HIV fund, Ministry of Finance was not able to do it because the question they asked, are we going to have cancer fund? Are we going to have malaria fund? Are we going to have, sickle cell fund? Are we going? So all these questions started coming up, and then therefore, after some time, finance notified us that we could not operationalize this. But for us in health, we would have loved to see this, because that will help us to cushion, to buffer, to give us a buffer when we see maybe funding is dwindling, but also to help us to create more commitment in terms of financing to keep on putting the seed money.
Walter Mwesigye, NTV.